Bismillahirrahmanirrahim. Today we are going to discuss contagious bovine pyelonephritis. Contagious bovine pyelonephritis is a specific sporadic disease of cattle which is characterized by purulent inflammation of the bladder, ureters and kidneys. This contagious bovine pyelonephritis is caused by Corynebacterium renale, which has three serotypes. Among these three serotypes, serotype 1 and 3, they are the most pathogenic ones. Corynebacterium renale is facultatively anaerobic bacteria having gram-positive properties, which is non-encapsulated, non-spore forming, non-mobile, and it appears as straight or curved rods under the microscope. Corynebacterium renale, it has pileated forms, and these pili, they are present on the surface of the Corynebacterium renale, and that helps in attachment of the bacteria to the epithelium of the urinary tract. In addition to this, these pili, they also contains an antigenic protein that causes the inflammation of the bladder tissue and further helps in the pathogenesis of the disease. Some of the bacteria, they are the normal flora of the vulva that has been isolated from the cases of contagious bovine pyelonephritis like Corynebacterium pilosum and Corynebacterium cystitis. Similarly, other bacterium like Corynebacterium pseudotuberculosis, Arcanobacterium pyogenes, Actinobacillus E. coli, Escherichia coli and Staphylococcus aureus, they have also been isolated from the cases of pyelonephritis singly or in combination. However, Escherichia coli is considered as an other cause of pyelonephritis in dairy cattle. Corynebacterium renale is not very much resistant to physical or chemical agents, and it can be killed by common disinfectants. However, it can survive in the soil for up to 56 days. While pyelonephritis, it occurs all over the world. It has worldwide distribution, but it does not constitute an important issue to any herd or to any area because it does not occur in the form of an outbreak. However, the clinical cases, they are sporadic. Occasionally cases they arise, and it is considered essentially a bovine disease affecting dairy cattle, dairy buffalo, and sometimes sheep and goat may also be affected. Uh, if we compare the male and female animals, the female animals, they are more prone to pyelonephritis compared to the male animal. Reason is the anatomical structure of the urinary tract. The females, they have a short and wide urethra that give more chance to the bacterium to penetrate, to travel up to towards the ureters and the kidneys. And other reason is while the males, they have long and narrow urethra. Moreover, female animals, they are more prone to injuries during the parturition or during the breeding. Sources of infection, the urine of affected animal or the urine of carrier animals is the source of infection. Similarly, rodents, they can be the source of infection. If the bull is infected, the semen of that bull is a source of infection. Sometimes the vagina or vaginal vestibule of healthy cows that may be contaminated with Corynebacterium renale or other organisms. Similarly, the environment of the infected animals, particularly the dust, it also contains the Corynebacterium renale. The transmission of Corynebacterium renale, it can be direct or indirect. With direct contact with the urine of the infected animal, or use of contaminated brushes, or careless use of catheter. This is the most important. If we use a catheter from a diseased animal, and then we use the same catheter to the healthy animal, we can transmit the infection. This disease can also be transmitted venereally during the process of coitus, and this organism has also been isolated from the prepuce, from the urethra, and from the semen of the bulls, as I have mentioned earlier. However, in bulls, this organism, it causes blenoposthitis in male animals. How this disease develops, what is the pathogenesis? So, pyelonephritis develops as an ascending infection, means organism travels from urethra to the bladder to the ureters and then to the kidneys. So, if there is a trauma to the urethra, or if there is a that can facilitate the traveling of the infection, and if there is a urinary stasis due to some obstruction in the urinary tract, that can also facilitate the ascending infection. Destruction of the renal tissue and obstruction of the urinary outflow, they are the outcomes of the infection, and due to this destruction of the renal tissue and obstruction of the urinary outflow, it leads to uremia that ultimately leads to death. So far as the clinical signs of contagious bovine pyelonephritis they are concerned, so early signs they can vary from case to case. However, the first sign is blood stained urine that means hematuria. It's not hemoglobin urea. Hematuria, pure blood comes out in the urine, along with the attacks of acute colic in cattle, and there is a frequent swishing of tail, and treading of the feet, and kicking at the abdomen. These are the indications of abdominal pain. When animals try to urinate, it strain. There is excessive straining during urination, and due to the obstruction of the ureters or the renal calyx by pus or tissue debris, there is this straining is due to the obstruction of the urinary tract by the pus or by the tissue debris, and at this stage this disease can be confused with acute intestinal obstruction. Most obvious signs they include the presence of blood, pus, mucus, and tissue debris in the urine, and there is a frequent urination, frequent micturition, and urination may occur in the form of dribbles, like drop by drop rather than a stream, and animal feels pain during urination. When we examine rectally at early stages, the rectal examination may be negative, but at later stages, when you palpate the bladder wall, it will be thickened and there will be a contraction of the bladder wall, and both or one or both the ureters, they will be enlarged, and they feel like a cord like structures. When we perform ultrasonography of the urinary tract, there will be a reduction in the renal pelvis diameter of the kidney, there will be a reduction in the renal parenchyma, and the bladder wall will become hyperechoic due to inflammation due to thickness. And the course of the disease may vary from several weeks to up to months, and terminal signs are those of uremia. So far, how to diagnose? First, or tentative or clinical diagnosis is made on the basis of clinical signs and physical examination. In the laboratory, we can perform urine analysis, we can perform urine culture and sensitivity. When we perform urine analysis, you will find protein urea, excessive proteins, they are excreted in the urine, and there will be a blood mixed urine, means hematuria. Urine pH will be greater than 8.5 than the normal, and the specific gravity will be between 1.008 and 1.021. On microscopic examination of the film of urine, we can see pus cells in the urine, and we can also culture the urine for the isolation and identification of the bacterium. When we perform serum renal profile, serum creatinine and urea levels, they will be increased, and concentration of urea and creatinine 1.5 milligram per deciliter, and urea 100 milligram per deciliter, they carry grave prognosis. And then we can also diagnose the condition using ultrasonography. On a necropsy, we will find the kidneys, they will be enlarged, particularly in bovines. The kidneys, they are lobular, and lobules, they will be less evident than the normal kidney. The renal calyces and grossly enlarged ureters, they will contain blood, pus and mucous membranes. When we examine the bladder and the urethra, their wall, they will be thickened. They will, these are the kidneys of suffering from pyelonephritis. Like here you can see the pus in the renal calyx is decreased in size. Treatment for treatment, abrupt antimicrobial therapy is suggested, and it is strongly recommended to perform urine culture and sensitivity test to identify the gram positive or gram negative bacteria. However, whenever you are selecting any antibiotic, you must consider the nephrotoxicity of certain drugs like aminoglycosides, that includes gentamicin. And antibiotic therapy may be required for extended period of time, maybe 3 to 5 weeks period. For Corynebacterium renale, this penicillin is the antibiotic of choice when given at large doses, like 22,000 international units per kg body weight intramuscularly twice a day for up to 3 weeks. In addition to, we can give potentiated sulfonamides like trimethoprim sulfadoxine combination at the rate of 16 milligrams per kg body weight twice a day. If you suspect an E. coli infection, in that case we can go for ceftiofur sodium at the rate of 1.1 to 2.2 milligrams per kg body weight intramuscularly, or gentamicin, but keep in mind gentamicin has renal toxicity. In addition to these, other broad spectrum antibiotics like ampicillin, cephalosporins, quinolones, chloramphenicol, tetracyclines, and cefuroximes, they can also be used. In severe cases, surgery may be advised. If there is a unilateral one kidney is involved, in that case we can suggest nephrectomy. We can remove one kidney. However, if both the kidneys they are involved, then slaughter or euthanasia may be suggested. There are no specific control measures for this contagious bovine pyelonephritis. However, the affected animals they should be isolated from the healthy ones, and all the materials like beddings or litter of the infected animal that must be properly destructed, and the population of the organism in the local environment may be reduced by using disinfectants, and then by that minimize the opportunity of the transmission. Especially the urinary catheterization that should be avoided from infected animals to the healthy animals. And whenever you perform routine vaginal examination or rectal palpation like pregnancy diagnosis, or especially this the vaginal examination that should be conducted by adopting hygienic measures. Thank you very much.